If you buy your own health insurance, or if you're running a small business right now, your monthly budget is about to take an absolute beating.
A quiet regulatory shift just slammed into the system, and it is literally doubling premium costs for millions of families. We're talking about a change so massive, it's forcing even high-earning households to completely rip up their long-term financial plans. The American middle class is basically in free fall over a hidden cliff right now.
So how do we get here? Well, when Congress deadlocked and allowed the enhanced premium tax credits to just vanish overnight, the financial safety net disappeared with them. This wasn't some minor policy expiration. This was the exact core driver behind that historic 43-day federal government shutdown. The old protections evaporated, plunging the entire market into a new reality defined by an incredibly steep, sudden subsidy cliff.
And this vanishing safety net is exactly why healthcare affordability has now completely eclipsed the general economy and inflation. It is now the absolute #1 domestic worry in America. People are sitting at their kitchen tables, looking at their monthly bills, and realizing the math simply does not work anymore.
The sheer scale of this disruption is staggering. We aren't just talking about abstract percentages on a chart here. This is a brutal household squeeze. Roughly 1/3 of all American adults, that is over 82 million people, are now being forced to stretch out their prescriptions, delay their retirements, or even postpone buying a home just to cover medical bills. It's fundamentally altering the trajectory of daily American life.
But if you think these high medical costs only target lower income brackets, you might want to think again. The financial drag has climbed all the way up the income ladder. Right now, a quarter of households earning over $240,000 a year are reporting that sudden medical bills have actively derailed their long-term financial plans. It's the 240K income illusion. Nobody is fully insulated from this.
Because of this intense pressure, there's a massive, silent retreat happening in the background. A full 14% of marketplace plan selections never actually resulted in paid coverage. Think about what that actually means. People went through all the effort to sign up, they saw the invoice, and physically could not afford their very first month's bill. They had absolutely no choice but to walk away entirely.
So what happens to the folks who actually stayed? The ones who managed to cling to the market by downgrading are now trapped behind massive financial barriers. They're facing a record $7,476 average bronze plan deductible before their coverage even begins to kick in. Trying to save money on monthly premiums has essentially locked them inside a multi-thousand-dollar financial cage.
Now, in response to this compounding crisis, federal regulators, led by CMS Administrator Dr. Mohammed Oz, just finalized a massive deregulatory redesign of the system for 2027. They are completely rewriting the rulebook on how insurance functions in the individual market, all in an attempt to bypass this current pricing gridlock.
Their primary solution? They're opening up bare-bones, catastrophic insurance plans to absolutely anyone who is locked out of subsidies due to their income. Previously, these types of plans were highly restricted, but now, insurance companies are authorized to lock consumers into these stripped-down plans for up to 10 consecutive years. It is a massive pivot away from what we'd consider standard, comprehensive coverage.
Okay, so the upside here is significantly lower monthly premiums, but the financial exposure is, frankly, astronomical. Under these new 2027 rules, family out-of-pocket maximums are climbing to a staggering $31,200. That right there is the true hidden cost of lowering your monthly payment.
The administration argues that this redesign finally gives choice back to the consumer, allowing them a way to escape suffocating premium costs. But on the other side, health advocates are sounding the alarm. They warn that this permanently shifts the risk of catastrophic medical debt off the insurance giants and directly onto the shoulders of working families. It's a profound philosophical shift in who exactly bears the financial burden of getting sick.
And behind the scenes, there's a massive conflict brewing. You see, regulators didn't release this 2027 overhaul until mid-May, which was right in the absolute middle of the industry bidding cycle. Because insurers suddenly have to make critical pricing decisions with incredibly compressed timelines and incomplete information, they're submitting defensive, higher-than-necessary premium bids just to protect their own margins from the unknown.
Adding even more friction to the mix is this new non-network exchange experiment. Proponents argue that cutting out traditional doctor networks slashes administrative overhead and drives premiums down. But industry critics warn that this shifts the entire burden of negotiating rates directly onto the patients themselves. It exposes them to rampant balance billing, where they just get stuck paying the remainder of whatever a hospital arbitrarily decides to charge them.
We're also witnessing a severe clash between trade policy and healthcare costs right now. Major commercial insurers are actively raising premiums to price in massive supply chain shocks from proposed 100% tariffs on foreign medications. While the overarching policy goal might be to boost domestic manufacturing, the immediate on-the-ground reality is a pharmaceutical tariff paradox that's hitting the consumer's wallet today through defensive premium hikes.
All of this leads to one pretty terrifying realization about this crisis. In the new landscape of American healthcare, we aren't really paying premiums to cover our medical care anymore. We are paying premiums just to buy the right to negotiate our own medical debt.
Looking forward, because federal legislation is completely gridlocked, your healthcare affordability will very soon be dictated entirely by your zip code. It's creating severe geographic affordability fragmentation. If your state can afford to build its own financial backstop, you might be shielded. But if you live in a state without those resources, you are going to face a continuing exodus of insurers and compounding premium spikes entirely on your own.
I want you to drop down into the comments and answer this. Are you personally willing to accept a massive $31,200 out-of-pocket risk just to lower your monthly premium? Or has the middle-class safety net officially broken in your state?
An investment in knowledge pays the best interest, so why not invest in this channel? Click like and subscribe for more.